So in our first discussion of abortion law, we looked at the grounds for abortion under the Abortion Act, and we saw a number of key themes that emerged elsewhere in the course. One of those is the medicalisation of the decision. The way in which we've defined the grounds for abortion uses medical terms, the risk to the health of the mother or the other family children. We also see how that extends to terms that are not necessarily medical. So we have to consider whether there's a substantial risk of serious handicap. The substantial risk is a prediction, and you might think that's all about medical expertise and judgment. But what counts as a serious handicap in our society is clearly something that is a matter for a wider discussion, not just amongst medics. So that drives people's concerns that we are overly medicalising social and moral judgments. On the other hand, the Abortion Act also shows us that when you think about how to regulate that, it's not that easy to decide on a different police person than the medic. So the Abortion Act decides that what matters in terms of criminal prosecutions is not so much whether or not those circumstances actually exist, as whether or not the people taking the key decisions, in this case the two doctors deciding in good faith, believe that those circumstances exist. So on the one hand, we can say that whether a handicap is serious enough to justify an abortion is something that is not purely medical, but in governance terms, when you decide who gets to make the assessment, we've decided that it should be the doctors who judge that, and that we shouldn't allow the police to become too closely involved, and indeed the courts, as the President, in the case of BPAS and Patton identified, suggested it would be a very bold judge who tried to interfere with that. So on the one hand we see medicalisation and get concerned about that, and on the other hand we see that medicalisation is a deliberate governance choice that we've taken. And that links to a further interesting question about the role of medicine in these decisions. When you look at the Abortion Act, it's clear that what the Abortion Act enables is women to have access to terminations, but it doesn't guarantee them. So you might say that it creates a liberty to have an abortion in the circumstances that the Act describes, but it doesn't give you a right to do so. And it might be that we should go further than that, perhaps building on Article 8 of the European Convention on Human Rights, as Rosamund Scott suggests, and suggests that we should have a stronger entitlement to access to abortion, and that we should go beyond the idea that it's okay to have an abortion in these circumstances, to say that the NHS should make sure that it's actually possible. So that gives us an indication of the role of doctors versus the patients, in this case the women, who are taking decisions. And that raises a further question about how interested we really are in morality. Are we interested in the legality of a termination, or are we interested in the motivation of women seeking an abortion? And that plays itself out significantly in the discussion about abortions on the basis of sex. We know that early terminations are lawful because they fall within the first ground of the Abortion Act, that it's more risky to go on with the pregnancy than to stop it. Should we also worry about whether the reasons that women have for having terminations are ones that we regard as morally valid? But if we do that, we need to do that about lots of other decisions as well. So abortion brings into focus a lot of the themes that we're interested in over the course.